This is Dr Eamonn Molloy, a consultant rheumatologist at St Vincent's Hospital in Dublin. And the topic is metabolic syndrome relevance to vasculitis COVID and beyond.
So I guess I wanted to discuss the metabolic syndrome for a number of reasons. You probably are all familiar with regards to the risk, the extra risk associated with more severe forms of COVID-19 infections in the setting of the metabolic syndrome, which kind of incorporates diabetes, high blood pressure, and obesity. But I guess it is also relevant to patients with vasculitis, which can have a higher incidence of the metabolic syndrome for various reasons, potentially including certain medications and especially steroids. But it's also very relevant to many of the family members of patients with vasculitis because of the great prevalence of the metabolic syndrome in Irish society in general. And this is just one particular figure from a study in the Lancet a number of years back, but this shows that we're essentially have the highest average body mass index of any of the EU countries listed, and we're coming close to some of the countries with the highest rates, such as the USA. So it's something that we all need to be mindful of in terms of our general health. So the risk of the metabolic syndrome is very much correlated with weight, and if you have a normal body weight, however, there still is about a 5% risk of the metabolic syndrome. This is probably those people that their genes don't lead them to gain weight, but they may exhibit other elements of the metabolic syndrome. If in people that fit into the overweight category, there's about a 22% risk of the metabolic syndrome, and 60% in the obese category will have metabolic syndrome. But note 40% of them don't, and those are generally much healthier patients with a lower risk of cardiovascular problems, etc., even compared to somebody at the same weight that has the metabolic syndrome. So just to expand a little bit in terms of what exactly is the metabolic syndrome, and essentially it's a fairly loosely defined collection of abnormalities that seem to hang together and seem to occur together with significant frequency. And essentially what we're taking in here is the obesity, and in particular the central abdominal obesity that is, I think, widely acknowledged to be associated with particularly unhealthy, in particular with various comorbid illnesses, but also high blood pressure, that's hypertension. Dyslipidemia just relates to the cholesterol, and it's a little bit more complicated than just the cholesterol, but there's some other fats in the blood as well that can be part of that. Insulin resistance, which is essentially getting you on the road to diabetes. And so some people won't be fully into diabetic territory, but they'll have high levels of insulin in the body. Their insulin production system is working extra hard to control blood sugar, and the body isn't responding very well to the insulin. And that's why you're cranking out more and more insulin. And then eventually it gets to the point where you just can't make enough insulin and you get into diabetic territory. But even the pre-diabetic state or insulin resistant state has its own problems. And also closely associated here is inflammation, systemic inflammation. And there's probably a two-way relationship between the inflammation of the metabolic syndrome in terms of causing various autoimmune diseases listed here, including the different forms of vasculitis, but also the inflammation in vasculitis can increase the risk of metabolic syndrome. And endothelial dysfunction, that other term listed on the left-hand side there, basically the endothelium is the lining of your blood vessels, and a key component of the metabolic syndrome is the fact that this lining doesn't work very well. And the lining of the blood vessel is really important in terms of the healthy function of your blood vessels, which are obviously important in terms of risk of, heart disease and other cardiovascular problems, but and blood pressure and so on, but also actually centrally involved in the control of inflammation in the body and most of the autoimmune diseases that we treat. So if we just focus for a moment specifically on the COVID-19, so the metabolic syndrome really has demonstrated a very clear association with worse outcomes. And for example, type 2 diabetes confers a 4.4-fold increase in COVID-19 mortality. But this is quite dependent on how well controlled your blood sugars are. So if you have poorly controlled blood sugars, it's a 10-fold higher mortality than in somebody whose blood sugar is well controlled. High blood pressure, hypertension, 2.5-fold increased risk of severe COVID and mortality. And obesity is a risk factor for more prevalence of pneumonia and requirements for needing a machine to support your breathing and getting into the intensive care unit, and more than doubling of the increased risk of doubling of the risk of mortality with higher rates, higher levels of obesity. There are other risk factors, as you probably know, age being a major risk factor, being male, and certain racial predispositions as well. These are things obviously you can't do a whole lot about, but when combined with the metabolic syndrome, clearly then it can really increase the risk of doing badly with COVID. So I guess that's why the metabolic syndrome is currently in the news. But I think it's a really important topic in general, not just of relevance to, as I say, vasculitis patients, but also the wider population. And this is because of the significant rates of a variety of complications, including progression to type 2 diabetes, cardiovascular and cerebrovascular disease leading to heart attacks, strokes, and dementia, obstructive sleep apnea, osteoarthritis, which is the biggest cause of disability in Ireland, liver inflammation, scarring, chronic kidney disease, and higher rates of certain cancers. But in addition, can predispose to certain inflammatory and autoimmune diseases, and we certainly wonder about it predisposing to many of the diseases we see. But the relationship is certainly quite complicated, but this cartoon just kind of illustrates the fact that, fat cells aren't just sitting there hanging out. They are actually very metabolically active. They make a lot of hormones, they make a lot of inflammatory proteins, these adipokines as they're called. And while we don't fully understand the mechanisms, it's certainly clear that these inflammatory proteins released by the fat cells can further increase the risk for metabolic syndrome, but also osteoarthritis and other inflammatory forms of arthritis and autoimmune disease. So the fat cells are not just a bystander in the whole process. If we turn specifically to vasculitis, vasculitis patients will be at an increased risk of metabolic syndrome, both potentially related to their underlying condition as well as the medications. The main medication we would be thinking of in this context are the steroids that you'll all know and love. And these do increase your risk for blood pressure, increase your blood pressure, or your cholesterol, as well as your risk of diabetes and obesity. The condition itself can reduce your exercise tolerance or capacity because of muscle weakness. The steroids can help with that. But also some patients with vasculitis will have nerve damage or lung disease, or depression as a consequence of their illness and or indeed the steroids as well can affect mood. And all of these factors can predispose to weight gain, which again can exacerbate the risk for metabolic syndrome. High blood pressure, hypertension is a complication of large vessel vasculitis. If you've got blockages in the arteries to the kidney or stiffness in the aorta, but any form of vasculitis that causes kidney damage, obviously ANCA-associated vasculitis would be a key one here. They can all cause high blood pressure. And a particular note of concern in patients with large vessel vasculitis is that it may be difficult to measure blood pressure, because if you've got blockages in the arteries to both of your arms, you won't get an accurate blood pressure reading in either arm. You may need to measure it in the leg or indeed in some other way. Okay, so I think it's important to bear in mind that patients with vasculitis have a higher risk of non-vasculitic vascular or blood vessel disease. Heart attacks and strokes are more common in patients with vasculitis in general, with autoimmune disease in general as well, for example, rheumatoid arthritis and lupus. And this is felt to be due to the chronic inflammatory state, and there seems to be an increased risk of clotting problems in general in these diseases. And these events are more common during periods of active disease or flares. But clearly the risk of these events would be heightened even further in the presence of the metabolic syndrome, which is why when we're seeing you in the clinic on an ongoing basis, aggressively thinking about and managing elements of the metabolic syndrome and cardiovascular risk factors are important. So it's no secret that there's been a major increase in the rates of obesity and the metabolic syndrome in Ireland and indeed much of the world. And this has been attributed to what has been referred to as an obesogenic environment, essentially, that the environment that we have created for ourselves has really facilitated and promoted high levels of obesity. And this is really multifactorial, but certainly some components to it are the food industry, which have obviously developed a whole variety of expensive processed foods that they can make a lot of money from, and they engage in a lot of advertising to sort of bombard you about how you should eat this and how you're going to feel if you eat the other and all the rest of it. The low-fat diet has probably been one of the biggest disasters in human health, and really has led to high rates of obesity, diabetes, and many of the illnesses of Western society. And that's again has been at least a lot of the marketing, if stuff was marketed as low fat and this, that, and the other, but they might neglect to mention that because it tastes so much worse when they take the fat out, that they've had to just fill it up with sugar and salt to make it palatable. But these sugar and salt laden foods are clearly very addictive and but don't actually satisfy you for any great length of time. The diet industry, of course, is another money spinner, and the sort of crash and fad and yo-yo dieting actually tends to make the problem worse and increases probably called the set point. I'll talk a bit more about that in a moment. You could, I think, put in here other industries such as, the gym and exercise industries and pharma industries, which clearly benefit from this whole situation. So I guess that many people nowadays are literally on a roller coaster all day long. They're going from one carb high to the next, one sugar hit to the next. They're up and then they're down, and then they're up and then they're down, and they've kind of barely eaten before they're bonked and looking for the next hit. And, it's very hard to avoid those hits. And if you're at the bottom of the roller coaster and you happen to go in to just get some petrol or something, because it's very hard to buy anything anywhere without seeing a whole wall of chocolate facing you, etc. so it's all around you, and very difficult to avoid if you're on that roller coaster. This stuff in the bottom right hand corner, I would kind of reserve that for that sort of stuff for cleaning your drains. So you hear all of this about, I need to keep up my blood sugar. So in your entire blood volume, there's about 1 teaspoon of sugar. So, with, what is it, 8 to 10 teaspoons of sugar in a can of Coke, depending on what size you use, maybe you're adding a couple of spoons to a cup of tea or a cup of coffee. Really doesn't take much. And, you can imagine even a couple of spoons of sugar, or teaspoons of sugar, is going to put a major stress on your body trying to deal with that. And actually, there are certain fats and protein components that are essential components of the diet, but you can actually make glucose from fat or protein. So if you actually took in no glucose at all, you could make it inside the body. So in fact, the amount of sugar you actually need to eat to survive is 0. So if we talk a little bit more about body weight, so there's often a very sort of simplistic, it's all about calories in and calories out, and it's food intake balanced with exercise output. So actually, it's not quite as simple as that. So who do you think burns more calories per day? So this is on the top left there, you actually have members of the Hadza tribe, which are a tribe in Tanzania that's still engaged in a hunter-gatherer lifestyle. So you can imagine they're on the move for long periods of the day, often covering many kilometers, trying to hunt and gather their food. And then in the bottom right, you have a sedentary New York office worker. So you might assume that the Hadza folk burn more calories per day, but actually they've done a study to look at this, and essentially it's about the same. So both study groups essentially burn the same amount of calories per day. So it doesn't make a lot of sense, does it? They've actually reproduced the study in other settings. So let me introduce you to the boss. This is the hypothalamus, and your hypothalamus is your boss. So that's Al Capone, by the way. So I suspect you don't give a whole lot of thought to your water intake, urine output, or your heart rate, or your temperature regulation. And that's because your hypothalamus controls all of these. But your hypothalamus also controls body weight very effectively via hormonal control of food intake and energy output. Clearly maintaining weight and something critically important for the body. So over the course of evolution, this wasn't something that was going to be left to chance. So the hypothalamus, as I say, is the boss in this regard. And essentially what this boils down to is we have a set point. And this is influenced by a variety of factors. But I suppose the key principle here to bear in mind is that we have a basal metabolic rate. And this is the energy that's used for the normal day-to-day metabolism or housekeeping in the body, the things like breathing and all the other things that happen on autopilot that you don't actually think about. And that makes up typically about 70% of your energy expenditure per day. The sort of mooching around that you do is the next sort of 25 to 30%. And maybe there's a couple of percent then of actual intentional active exercise that you do. So, the importance of this, active exercise is really very much over emphasized. So, essentially, what happens if you eat more and or exercise less, you just burn more. Your hypothalamus revs up the burners and activates what's called the sympathetic nervous system. So this is your fight or flight system. So normally this is just activated in times of danger. So this was normally something that when there was a physical danger, you were trying to either avoid being eaten or avoid being injured by something. And so there's an elevation of your heart rate, your blood pressure, your temperature, there's a lot of sugar released into your bloodstream so that your muscles can soak it up and really, you kind of use it for a rapid burst of energy. And also the natural painkillers or opiates are released to essentially, override any pain that you might experience in terms of getting out of that dangerous situation. So this is obviously just normally meant to be something that's activated for a few minutes, and then you escape that situation of danger. Your fight or flight system deactivates and you go back to normal. The problem is that when you're kind of eating more and exercising less, your sympathetic nervous system is really kind of in overdrive, most or all of the time. So you can see how that can lead to a chronic elevation then of your blood pressure, blood sugar, pushing you into diabetic territory, etc. Plus, you kind of get that kind of buzz from your natural painkillers, your opiates, and so that's why you're kind of on that roller coaster and kind of chasing that next hit. So on the flip side, if you kind of do like the Hadza tribe that I just showed you the picture of, and you're eating less and exercising more, then you burn less, so you don't get all of this activation of your sympathetic nervous system and the high blood pressure and the blood sugar elevation and all the rest of it. So the set point is affected by a variety of hormones. Central here are things like insulin and cortisol, which is your stress hormone, as well as leptin, which is one produced by your fat cells. So I won't go into it in any great detail, but I guess there's a couple of key impacts of the set point. And one of those is weight gain. So actually, it's quite difficult to achieve intentional weight gain by intentional overeating alone. As if you've got teenage blokes that are trying to gain some weight in the gym and all the rest of it, and they're eating all the protein they can get their hands on and so on. It's actually still quite difficult to do that because as soon as you stop, doing it, the overeating, you'll get a significant weight loss, but there's also a limit on the amount you can gain because the hypothalamus essentially reduces your hunger drive and also increases your metabolic rate so that you just burn off more energy. And the flip side is also true, as anybody who's engaged in a kind of a crash diet will tell you. Weight loss, it's actually difficult to achieve by undereating alone. It takes a lot of willpower, and you can keep it going for a while, and then maybe another while, and then eventually, it's sort of, you cave in, and then you get a rapid weight gain and back to the set point. And in fact, usually beyond the set point, because the hypothalamus gets the message, crikey, there's a bit of a famine situation out here. We don't know exactly when that's going to happen again, so we better just set the set point a little bit higher so that with a bit more buffer, a bit more protection from any kind of other famine situation or deprivation situation that's coming down the tracks. So that's mediated via increasing hunger and by reducing the metabolic rate. And that's why fad diets are a total waste of time. So this obviously sounds like a total mess. How can you improve on this? So a couple of the key things are really trying to do what you can to lower insulin levels, get off that roller coaster. And so firstly, it's to eat less in general, which is very difficult to do when you're on the roller coaster. So some of the key things are trying to reduce carbohydrate intake, with the exception of veg and some fruit. And also really trying to eliminate sugar to the fullest extent possible. Eating unprocessed natural foods, high in fat, and moderate protein intake. Nobody ever got fat by eating healthy fats. It's the man-made processed fats that are in so many of the processed foods that really are very problematic. And so avoiding processed foods and drinks to the extent possible is key. But also animals and fish that have been fed a diet of processed food. Whatever you are, what you eat, but you're also influenced by what was eaten by what you eat. So lowering cortisol, that's your stress hormone, that's another key thing. And often something that's talked a lot about and easy to say and harder to do. And so stress reduction strategies, of which there are many, but it's paying particular attention to sleep quantity and quality, exercise. So the role of exercise is not really about burning calories, so as I kind of mentioned earlier, if you burn a whole lot of calories with exercise, you're just going to reduce your hypothalamus will reduce your metabolic rate and, compensate for that. So it's really about stress reduction and therefore lowering cortisol, which can lower your set point in that way, but also by exercise improves your body's responsiveness to insulin, and so then your insulin level reduces as well. But the obvious things, the simple things like exposure to nature, social interaction, etc., can also help lower cortisol. So as I mentioned, one of the key elements is increasing natural fat intake, and there's various iterations of this in terms of a low carb, healthy fat intake, and elements of this are within the Mediterranean diet and things like a kind of a ketogenic diet. All of these things that are sort of in vogue nowadays, but certainly there are strong evidence to suggest that they can improve your metabolic profile. Another point just to finish up on, worth a mention, are your gut bacteria, or your microbiome as it's called. And it may be somewhat disconcerting to hear it, but in fact you have trillions of bacteria in your large bowel, and the vast majority of them are your friends. And so you should look after your friends, and if you look after them, they'll look after you. And how can you look after your gut bacteria? So there's probably a number of things that you can do. So obviously things like avoiding unnecessary antibiotics, but also avoiding processed foods are of benefit. Intermittent fasting is obviously in vogue, and this is something that can be as simple as delaying the first meal of the day, or avoiding eating for a few hours before bedtime. So just even if you eat the same amount of food, but just within a shorter window of the day, that has important metabolic benefits, as well as an important impact on promoting the development of the gut bacteria that you want to be in there. Fiber is another critical thing that's quite deficient in the Western diet, and fiber, insoluble fiber, essentially kind of cleans out your gut and gets to the large bowel, because obviously, as the name suggests, it can't be absorbed, but your gut bacteria can break it down. And so essentially you're serving up a meal to your gut bacteria if you ingest plenty of insoluble fiber, and they'll return you the favor by generating a number of anti-inflammatory and brain protective compounds that you'll certainly benefit from. So so that's kind of a whistle-stop tour of all of that. I'm happy to take any questions at this stage.
Thank you so much, Dr. Molloy. I'll let Patricia now.
Yeah, that's great, Eamonn. Thank you so much. I was just thinking as you were talking there, it's so relevant to what we're all being told in this time of COVID, that we need to take care of ourselves, both physically and mentally. So
absolutely,
I think
absolutely.
Really appropriate. I think, yeah.
I didn't really touch on it there, I guess, but I think in terms of mental health disorders, depression, anxiety, and potentially others are also heavily influenced by the dietary issues that I mentioned. So
we have a question there, Dr. Molloy. Are probiotics beneficial?
I think probiotics are okay. I guess. I had one lady in with me this week who was shelling out €100 for some sort of, gloop that she, got. And I mean, I don't know, it just seems quite expensive, for a supplement. And, bear in mind that the bacteria that you ingest as part of, a yogurt or whatever, it has to get all the way through your the boiling vat of acid that's in your stomach and all the way down through your bowel to the large bowel to kind of be relevant. So I think, you know, fermented foods and so on have other important health benefits, and you know, but the sort of kind of gimmicky yogurt probiotics, I'd be less enthused about, and certainly buying expensive probiotic supplements, I'd be a little bit cautious, you know.
And that kind of answers the next question here. You mentioned probiotics. What is the best source of them? I think you've kind of touched on that there.
I think the best thing is, so don't forget that, I mean, I guess my other skepticism about probiotics is that, you're taking in a few million bacteria in the yogurt or whatever. You have trillions of bacteria in your large bowel. So, you know, it's hard to know how much, you know, taking in a fairly trivial number as part of the probiotic is really going to make that much of a difference. Whereas if you're increasing your fiber intake, you're intermittently fasting, you're getting the right types of diet, including, you know, the low carb, the high fat, that sort of thing, that can actually drive and promote the development of a different species of gut bacteria that promote that reduce inflammation and promote health.
Perfect. And is there any other questions now? I think there was just those two questions. Anyone else have a question? I think that might be it.
I think I just want to just link it as well, Eamonn, that at the very beginning you were linking the syndrome to the inflammatory response as well. And of course, with the vasculitis, that's what we all know. Yeah. Vasculitis and that inflammatory response. So I think that's something, you know, you might see it, some people might see it separate, but it's actually just totally related in this syndrome.
Yeah, I think I kind of touched on how, you know, patients with vasculitis can have a higher rate of metabolic syndrome kind of as a secondary phenomenon. What we really, you know, don't know, I guess, is to the extent to which elements of the metabolic syndrome can predispose or you know, promote the development of autoimmunity and vasculitis. And so, you know, there's certainly some work being done on that in more common diseases like, you know, rheumatoid arthritis, psoriatic arthritis, psoriasis, etc. It's a little bit harder to study in less common conditions like vasculitis, but I think we certainly would suspect that that's potentially a factor. And you know, obviously, you know, there's plenty of people that get vasculitis and they're not overweight, you know, but as I mentioned, there are a proportion of people, although relatively smaller proportion, that have a normal body weight, but they still have elements of the metabolic syndrome. So it's, you know, it may well be that those patients have, you know, those sort of drivers for their autoimmunity.
That's great. And those slides will be available. The talk is being recorded, so if anybody has a particular interest, they can go back over that. Yep. Thank you so much. It was really
interesting. No problem.
That was fantastic. I think everyone thoroughly. I know everyone's on mute and hidden, but I think we all thoroughly enjoyed that. Very insightful.
Okay.
Thank you so much.
No problem. Okay, thanks.